Welcome back. My name is Matt Reiners, and I'm the co-founder of Eversound, a company dedicated to improving quality of life for older adults by giving them the gift of hearing. Today, I'm joined by Dr. Tariq Adwan, the Chief Scientific Officer of GeneIQ, a precision medicine and diagnostic program serving senior living communities across the U.S. I recently connected with Frank G. Howard, the CEO, and enjoyed learning about GeneIQ and how intelligent diagnostics can significantly change the quality of life for seniors and greatly help their caregivers and residential community operators have a leg up on keeping them healthy and well. Dr. Adwan is the scientific mind behind GeneIQ and has a passion for helping seniors stay healthy, first and foremost, and when they do decline or become sick, he believes having an effective treatment plan is the primary goal. So thanks for joining me today, Dr. Adwan.
Good to be with you, Matt. Thank you for having me.
So, Dr. Adwan, first question. Can you share a little bit of your background and how you got into senior living and to Gene IQ?
Sure. So I'm a scientist by training. I received my PhD in stem cells and developmental biology from the University of Colorado years ago. And I've always been interested in genetics and ever since honestly I was in middle school. And throughout my career, I've really used genetics to really better understand disease and also understand how we can better treat disease. So my PhD thesis was in head and neck cancers, and one of the statistics that was really surprising in cancer in general is that cancer drugs typically work in only one of four patients. And because the mortality rate of cancer, or for cancer, that means that for every one patient we treat, unfortunately, three will ultimately die. And at the time, I thought this was that this high rate of therapeutic failure was really specific to cancer. However, as I explored this more, I realized that this issue of lack of response to medications was not necessarily specific to cancer, but was actually a fairly relatively common problem across medical specialties. So, take for example SSRIs. A typical SSRI is likely to be ineffective. So it's likely not to work in about 30% of patients. A typical diabetes medication is likely to be ineffective in about 43% of patients. And so while the lack of response is bad enough, right? What's even worse than that is adverse reactions. So when the drug actually causes more harm than good, and ADR are ranked as the fourth leading cause of death in the United States. So as I developed a better understanding of the impact of intra-individual variability between patients for drug response, I decided to dedicate much of my career to really implementing pharmacogenomics at testing as a standard of care. So now, why the focus on senior living? Well, as you know, seniors tend to be polypharmacy or on multiple medications on average. A typical senior is taking 15 plus medications. So I see pharmacogenomics as being especially impactful at a senior living population where there is a high prevalence of medications, and as such, there is high prevalence of medication failure and adverse drug events that could potentially be prevented.
Wow, that's awesome. Yeah, and it's pretty mind-boggling too, and it's awesome to hear your story here. And I know when I talked to Frank Howard, we spoke a lot and about this pharmacon. And look, it's so new that I even struggle to say it, but it's pharmacogenomics test or this
Right.
PGX test.
Yeah.
When we had him on the
Yes.
yeah,
That's a short word for
P
pharmacogenomics.
Well, I'm glad we could say PGX now on this podcast because I need to go and practice that word that much more. And you can see how raw this interview is. But this test, right? It's futuristic, high tech, precision medicine stuff. And let's start with the basics. Like, what is the PGX test?
Right. So PDX sense is the science of determining how genetic variability influences physiological responses to drugs, right? So that's from absorption, how do patients absorb a medication, how well they metabolize it, all the way to what kind of therapeutic effect it's going to have to on the patient. So simply put, just like how we all differ in how we metabolize food and nutrients and respond to different types of exercise, we also differ in how well we metabolize medications. So take, for example, a drug like Plavix. So Plavix is a blood thinner. It's a commonly used blood thinner, and it is metabolized by an enzyme called 6-G-syntactine. Well, there are genetic variations with it. We all have this enzyme, by the way, but there are genetic variations within that enzyme that makes it overly active in a subset of the population and have a decreased activity in another subset of the population. And so it is used, this enzyme is used to basically break down Plavix from an inactive form to the active form that ultimately is what's going to have the therapeutic effect or therapeutic benefit. Well, 30% of the patient, of all of us really, had a deficiency or have a decreased activity in CT1. So what that means is 30% of us that if we take Plavix, we would actually be at a still at a significantly higher risk for MI, myocardial infarctions, heart attacks, or stroke, even when we are taking or taking Plavix. Uh, it's funny, pharmacogenomics is, we're starting to hear about that, right? But it's actually not in science. It's a fairly old science. And the dates of the beginnings of pharmacogenomics really date back to Hippocrates' days. The father of Western medicine, and he was famously quoted one time saying that it is far more important to know what person the disease has than what disease the person has. Okay? And so while we knew this inter-individual variability, genetic variability between individuals existed for many years, and we knew that really impacted how well they respond to medications, we really couldn't identify what these variants are until recently. So the sequencing the human genome, and more so, the technology needed to be at a different place where we can test patients in a relatively cost-effective manner. So those days are now, really.
Wow. Yeah, it's amazing. And when you think about it, it makes sense too, right? And I know I didn't know about this until I was first encountered you all and kind of learned from it from there. So it's really cool. And I guess my next question here for you, Dr. Adwan, is, why is it good for seniors to take one of these PGX tests, especially those living in senior living communities?
Yeah. So as I mentioned, the older we get, the more medications we tend to take to treat various disease conditions that we develop as we age, right? And so the challenge with that is our tolerance for medications decreases with age. Our liver, kidney functions sort of naturally goes down as we get older, and so the risk for adverse drug events actually increases. One of the most common adverse drug events in senior living settings is where it falls, right? So the risk falls. So it becomes especially important as we get older to really consolidate the medications that residents are on and ensure that they are taking the necessary minimum, really, amount of medication that is both effective but also safe for them. And we can accomplish this with a pharmacogenomic test. So the other reason is, healthcare today is fragmented, right? And so by the time a resident really makes it into a senior living, community, they would have seen many physicians over the course of their life, and over that they probably would have even seen multiple physicians for the same condition. And so what that ends up happening, or what that ends up doing, is that they end up being put on multiple medications, believe it or not, to even treat the same effect. And so we see that patients oftentimes complain of side effects. And what do we do when they complain of side effects? We actually put them on more medications to treat those side effects. So that's how we end up with an average of about 50 medications 50 prescriptions that a typical, resident in a senior living facility. So pharmacogenomic really presents an opportunity to precisely and simply de-prescribe actually medications at that point, and really eliminating those that might be ineffective for the patient or causing them side effects. And in doing so, we also eliminate another group of medications that were given in the first place to actually help with the side effects of the medications that are not working. So all in all, it really does eliminate, this trial and error approach and does help the prescribing process for a lot of these residents.
Yeah, no, and it's so true because I remember visiting my grandmother and was just amazed by the amount of medication that she was on. I remember like she had their like little pill thing and was able, I was just blown away because myself, I wasn't taking anything at that time, and so of course, like the seniors we know and love are on a lot of medicines, right? Like you'd mentioned that anywhere from 12 to 15. And of course, it's a complicated business for senior living communities to keep track of all this, especially when they're taking that many. And I know you mentioned like you're looking to deep prescribe. Is this kind of where Gene IQ comes into the formula for these communities? Like, how does that look?
Yeah, absolutely. I mean, just think about the time and effort it takes for an operator of a senior living community to really manage that many medications with different dosages given at different times of the day, across dozens and sometimes even hundreds of residents in a typical facility. So, um, you know, it's some of them before you eat, some of them after you eat, some of them are once a day, some of them are twice a day, and so forth and so on. So no matter how good of a system a senior living community has to keep track of all that, it still is a fairly labor intensive process, but also prone to errors. So there are errors really with how we administer a lot of these medications, and that ends up causing adverse reg events as well. So all in all, reducing the number of medications can only make this process less labor intensive and less prone to error. And that's just one of the many benefits really for the facility of implementing a pharmacogenomic program.
Yeah. And I know, GeneIQ is a program for seniors that qualify for this test in residential communities. Who should get that PGX test in those settings? Is it just those people who are on dozens of medicine or, what do you think about that?
Right. Yeah. So that's a great question. So correct. I mean, pharmacogenomics is a clinical test. And so it's a physician prescribed test. And one of the benefits of pharmacogenomics is being cost effective, right? We're after solutions here that actually reduce the healthcare, expenditure, right? And one of the ways to ensure that we're doing that, or for pharmacogenomics to remain cost effective, is ensuring that only those residents that would benefit the most from the test are actually the ones that are taking the test. And so to do that, we've developed what's called a risk stratification process that looks at the number of patients, the number of medications that a resident is taking, their potential for drug gene interaction. Is their metabolism impacted by genetics? And any pharmacogenomic FDA labeling within the packet insert of medications that would actually point to the benefit of doing a pharmacogenomic test. And that's something I didn't mention before is, believe it or not, this pharmacogenomic information is actually in the packet insert of a lot of these, on a lot of these medications. So we utilize that as well. And so the outcome of this risk stratification process is that we have patients that would be categorized as on high risk regimen, moderate risk, and low risk. And so we deem those that are on high and moderate risk and potentially benefit from a pharmacogenomic test. And that's typically what the facility ends up doing, is testing those individuals first per pharmacogenomic test and kind of doing the rest of the patient population or resident population on a as needed basis.
Yeah. Wow. It's the more you talk about this, it just makes more and more sense. I mean, it's pretty amazing. And I guess I'm curious because of course, when these communities are doing something new, I think everyone kind of assumes it's going to be super difficult. And I'm wondering, like, how easy is this to incorporate the PGX program into the seniors wellness program? Like, how long does it complete to take the test? Does the doctor see these results? Like, what does that look like?
Yeah, that's a great question. So really, it's actually to conduct the test is very easy. It's a buccal swab. So we essentially swab the inside of the patient cheek, on both sides, 30 seconds on each side. So a total of a minute. It's less invasive than a COVID test that we've had to take at one point and, goes all the way up to the, back of your brain and almost tickles your brain there. So this is even it's simpler and less invasive than that. The patient doesn't necessarily have to fast per se, but we recommend that the patient doesn't eat or drink 30 minutes before the test. So when we're swabbing them, we're not collecting food and drink particles like that. And so, as you can imagine, that process for any facility who's dealt with foods the past 3 years is a breeze. It's not, labor intensive by any means. And the doctor would get a copy of that report. When they get a copy of the report, and we walk them through how to interpret the report first time, second time, or an as needed basis as well with a lot of these difficult cases. We have PharmDs on staff that actually would assist with that process to make it as easy as possible for that order to provider to really interpret and use the report to really manage patients' medications.
Wow. Yeah. It's pretty awesome. And, I know with this test, right, it helps to show the right prescription work the first time. And, you're a scientist, you're a doctor. What have you seen in seniors doing the GeneIQ program at their living communities as far as like the benefits from before to after a PGX test?
Right. So that as part of this, that's why we roll this in a program. We
Yeah.
we actually do track per facility. What were the key health metrics or quality metrics that we're looking at before, and then we track that throughout the program and at the end of the program, so we can show a lot of improvement on as a result of implementing a pharmacogenomic program. What we but this is not necessarily, like I said, this is really not deep, right? I mean, we've known the benefits of pharmacogenomics for a while. There are many publications that are published specifically on tracking outcomes of implementing a pharmacogenome program, um, uh, it could be upwards of 7 to 1% reduction in emergency room admission, about 39% reduction in hospitalizations and hospital stays. We talked about falls, right? And then a lot of that is because patients are really over medicated to the point that they're not necessarily, they lose balance. And again, a lot of patients are actually a fall increasing or risk increasing medications that would potentially be eliminated. So there is that benefit as well. So think about, also in terms of reducing that workload for the operators as well by improving overall quality of care. So really many benefits for pharmacogenomics. But that's one of the things that we also track on a per facility basis.
Yeah. And one of the questions that comes up during this is the cost, right? I think that's everybody front and center. It's always the $1 million question, right? And this sounds expensive. I could be wrong. So like how expensive is this PGX test for operators? Does the operator pay? Is the senior pay? Is this something covered by health insurance? Like, what does that look like?
Yeah. So the operator doesn't pay. This is
Wow.
when medically necessary. This test is covered by insurance and is covered by the private payers, and it's also covered by government payers, the Medicares and the Medicaids of the world. And that's why when we're doing the test, we're making sure that we do have medical necessity there to increase the likelihood that the patient's or the resident's insurance covers this test. So it truly is at no cost pretty much to definitely not the operator. There's no cost to the operator, but even to the patient. And that is, it varies, right? And then, anytime you bill insurance, depending on what kind of insurance plan the patient is on, what their potential out of pocket could change. But we have what's called a transparency billing model, basically. So if we think that the patient, based on their plan, medical necessities, going to owe any portion of that test, and we talk to them first before we conduct the test, make sure they're okay with it. And their exposure is maybe $100, maybe $200 or so, but again, that's going to differ per plan. So it's not thousands of dollars or
Right.
anything like that. So yeah.
So it's a lot less than being the $1 million question. It's a lot less than that. So no, that's super cool. I mean, it seems almost like a no-brainer here. And because like it seems like too with what you guys are helping with, right? Like, I think senior living, depending on who you talk to, are always emphasizing closing the back door, right? People leaving due to falls, people leaving and having to be hospitalized for whatever reason, and having to go to a different facility or anything else. And I'm curious how the GeneIQ PGX program helps operators to keep seniors living in their community longer and especially in improving their length of stay.
Yeah. As part of the program, resident engagement is actually one of the first steps that we take, right? Because this type of test, we don't do it without patient consent. So that is that is really becomes an opportunity for the patients, the resident, their loved ones, and the operators, the physician, us, all really engaged around one common purpose here, and that is to help the improve the quality of care and state for the patient, right? So resident engagement is kind of the front and center really of that process, and with that obviously comes operational efficiency for the facility. It lowers the workload, increases the overall quality of care, as well as the duration of care. Think about it, ADRs, their potential for the patient to actually leave the facility, go to a hospital to get treated for that. And depending on how severe that ADR might be, it could also lead to extensive and lengthy hospital stays where the patient is out of the facility. So avoiding unnecessary or unplanned discharges of residents due to ADRs and falls is certainly one of the many benefits of pharmacogenomic tests.
I guess one question I have, should I go get this test and learn about what medicine is good for me? I mean, I know we're talking about older adults here, but should anybody really go and get this test as they're kind of going on this medical journey here?
So if a patient is on medications that they're taking, treating a chronic condition, that I think by all means, everybody really that is taking medications, multiple medications, and really what constitutes polypharmacy is 3 to 5 medications that we're taking on a regular basis. So if anyone really sees themselves on that many medications, they're having issues with those medications, side effects, and maybe they're not working, then a pharmacogenomic test is probably right for them. So it's not specific to seniors. In fact, we have younger folks that are taking the test that are, dealing with mental health, dealing with cardiology, ADHD, dealing with a plethora of medical conditions that would benefit from the test regardless of their age.
Well, yeah. My last question here for you. If you were to give senior living providers just 3 guiding principles as they navigate the next 12 months or so, what would you say?
Yeah. Well, first, I want to start by thanking all the providers, senior living providers that have already embraced pharmacogenomic testing as a standard of care in their clinical practice. So they're the pioneers, and kudos to them, and thanks for their partnership on that. And for those that really haven't necessarily embraced pharmacogenomics as a standard of care just yet, I'd say change is difficult, right? But we have to align on one simple fact here that healthcare today is just simply too expensive. It's too reactive, and it really is focused on a one size fits all for everybody. And simply, this is just not sustainable now, or really hasn't been in any time. So we have to think of creative solutions to reduce healthcare cost burden while driving better quality and outcomes. Regulators are already thinking in those terms. They're thinking in terms of what are the they're looking at outcomes more so than what services have been rendered. And so, and at first, really, pharmacogenomics might seem disruptive to typical traditional clinical workflow. And providers are already spread thin, but trust me when I say this, and I've been doing this for over a decade, that once pharmacogenomics is implemented as a standard of care within the clinical workflow, it it actually eliminates the time consuming and labor intensive trial and error approach that we have right now, and really streamlines that entire clinical workflow. So providers are working way too hard right now, and anything I think that could streamline that process and help take off anything but their off their plate is definitely a benefit. So they owe it to themselves, and certainly we owe it to our patients. And finally, let's remember, right, that whatever we do today to improve quality of care for seniors is ultimately an investment in our future, right? Because Matt, you and I might be young today, but we know that we're going to be seniors at one day, right? So hopefully, whatever difference we make today in improving clinical outcomes is something we find when we get older, and we get to benefit from that as well.
I love that. Well, thank you so much, Dr. Adwan, for joining us here today. I learned so much personally, and I know our listeners will get a lot out of this too. So I appreciate you coming on.
Thank you for having me. Appreciate your time.